Good afternoon and welcome to this town hall. As the university prepares to kick off the fall 2021 semester, Penn State leaders are joining us today to provide updates on the university's planning efforts as the nation continues to manage the COVID-19 pandemic. In studio with us is University President Dr. Eric Barron. And joining from their offices and remotely are Executive Vice President and Provost Nick Jones, Vice President for Student Affairs Damon Sims, Vice President for Human Resources Lorraine Goff, and Director of the COVID-19 Operations Control Center, Kelly Walgast. First, Dr. Barron, do you have any thoughts you'd like to share with the audience?
Yes, thank you. I'm very much looking forward to welcoming all of you back to campus in a few weeks. I'm happy to be here today, joined by other university leaders. As previously planned, we began expanding the number of in-person courses this summer. In a few short weeks, we will move to a robust on-campus experience for the fall semester across all of our campuses. Our staff and faculty have also started returning to campus, with many having done so earlier this summer. While we look forward to a fall experience that's closer to what we used to have, we must remember that we are still in the midst of a pandemic. We've seen the spread of the more aggressive and more transmissible Delta variant and an uptick in infection rates around the world and within the United States, including Pennsylvania. I'm eager for the return of on-campus activities and to see students back in our hallways once more. While we anticipate what we believe will be an outstanding semester, I want to make sure that no one is left out. To promote the well-being of all Penn Staters, I strongly encourage everyone to receive a vaccine. Let me be clear. While we are not currently requiring vaccinations, Penn State is not impartial when it comes to getting vaccinated. The university's stance is that everyone who can get a vaccine should do so as soon as possible to attain very high vaccination rates on all Penn State campuses. Getting vaccinated is the single best way to protect yourself and our community from serious illness. According to the CDC, 99.99% of vaccinated Americans have not had a breakthrough COVID-19 case resulting in hospitalization or death. The vaccines work, and we need as many of you as possible to get a shot as soon as you can. Now, given evolving guidance and the more we learn about the course of this pandemic, we're making some adjustments to our health and safety approaches as we enter the fall. We will discuss these changes, as well as our current plans, later in this town hall.
Thank you, Dr. Barron. We're going to move on to questions now, and Dr. Barron, we will begin with you. As you said, with the highly transmissible COVID-19 Delta variant becoming the dominant strain in the U.S. and rising case counts nationally and in Pennsylvania, can you talk a little bit about how this has been factored into the decision-making for Penn State's approach?
You know, last year was hard. It was hard for all of us, but especially for students that did not have that Penn State experience, which makes such a difference. Delta's emergence as more virulent, more contagious, we must rethink our strategies. So first of all, we're encourage, please get vaccinated. Protect you and protect others. And I want to point out in particular for you to think about all those other members of our community who may have children at home or other people that are at risk. Protect everybody as our community. Get vaccinated. We know that individuals that get vaccinated have mild or non-existent symptoms. It is the very best defense that we have against COVID-19. For students, if you're coming to live on campus, and you've not shared your vaccination status as being vaccinated, and you test positive when you enter, you will have 10 days in quarantine. It will be off campus or at home. You won't be allowed on campus. If you test negative, you can move in. For employees, we ask you to please upload your data. If you are not vaccinated, or haven't uploaded a vaccinated status, then we are developing a testing strategy, which we will be announcing shortly.
Kelly, in addition to the required on-arrival testing for students living on campus, is the university planning for other testing requirements in the fall? And what can you tell us about that?
Yes, thank you. So students that are coming and during move-in, and all students coming back to campuses, we would like you to upload your information by August 9th. That is a date you're going to hear frequently during this town hall. August 9th, please upload your information that you've been vaccinated. And so those of you that aren't vaccinated or have not shared information with you, we will have regular testing for you. As Dr. Barron just mentioned, before you move in, we're going to ask you to test before you move into our residence halls. And additionally, based on what we learn after the August 9th date comes in and passes, we will conduct additional regular testing for students on our campuses, on and around our campuses throughout the fall semester. Really important for us to keep an eye on this virus as it possibly could move through our communities. We are taking this really seriously, very seriously. So students will be notified when they need to test, and there will be significant consequences for noncompliance. And we encourage you to upload now so that you can not have to do this testing. Testing plans for our employees are under development as well. And those are employees, again, who have not demonstrated vaccination. And so we ask employees as well to upload their information into the Salesforce Health Cloud. Really important to do that as well in the next week so we have a better understanding of your vaccination status. But as Dr. Barron just said, we are developing a test protocol for those that are not vaccinated or who have not shared vaccine information with us in our employee population as well.
Thank you. Dr. Barron, the CDC last week issued new guidance that calls for vaccinated people to wear masks while indoors in areas with substantial or high transmission. How has the university taken this guidance into account?
Well, we pay attention to the CDC guidance and we pay attention to science. And so we're adjusting our masking requirements accordingly. We strongly encourage vaccination, even for those that are vaccinated, to wear a mask while indoors. For low levels of transmission, unvaccinated individuals must wear masks indoors. And then we will monitor county by county to determine what the transmission levels are like. If it reaches a high level, all individuals, vaccinated or unvaccinated, must wear masks indoors. We're already seeing the counties shift. We will watch them carefully and provide guidance accordingly.
Thank you, Dr. Barron. Kelly, can you provide a little more details about how that masking policy is going to work?
Yes, I can. The CDC has now a county tracker, a database that is updated daily by the CDC, and it allows us to see the transmission spread of the virus across the state of Pennsylvania by county. Very helpful for us to see that. And as you can imagine, over the last several days, the transmission in Pennsylvania is growing. And so we can see counties move from a low or moderate level of transition to a higher level of substantial or even high red status here in Pennsylvania. So that is something that will impact us in the campuses that reside within those counties. And so we will look at this daily, and more than daily, frankly, and those campuses that are home in those counties will shift to this more enhanced masking strategy after it moves into the substantial or orange category. Several campuses are in that window now, and so those messages will be coming out to people that are associated with those campuses very soon after this town hall. Now, we are looking at the data daily, and we want to make sure that we notice any fluctuations. So if a campus is between yellow and orange and may shift back and forth between those statuses, we'll watch it for a while, at 24 hours, make sure that it's really actually staying in the orange, and then initiate these changes in these messages by campus at by 8 o'clock that next morning. And that gives chancellors and campus leaders the ability and the time to appropriately message the faculty, the staff, and all the employees and our students that are with those campuses. So it's really important to know that this is happening here in Pennsylvania, and I expect it will continue to grow here in the next week. And so at this point, when a campus shifts into this higher level of risk mitigation, or all people masking inside, we will ask them to do that for at least 7 days. And that allows us to see what the data is going to do. We all hope that this eventually will reduce and we all get back down to a lower transmission of this virus. But we have to watch it and see what happens. It doesn't happen overnight, and it will take a period of time for that to go down. So we will be in contact with all the campus leaders and continue to message our communities about this as we move forward.
Thank you for that clarification. Provost Jones, if the pandemic takes a turn for the worse, does the university have plans in place for a transition to remote education and telework?
Hi, Ben. Nice to see you. Health and safety of students, faculty, and staff has been our top priority since the pandemic began, and that remains the case. And as you've just heard from Kelly and from President Barron, we've made adjustments as a result of CDC guidance, and particularly in response to the impact of the Delta variant. This includes, as you just heard, required testing of unvaccinated students and employees, and plans to alter our masking policy if needed in line with the CDC guidance. As with last year, our plans for the fall have various on-ramps and off-ramps prepared as contingency plans to respond to changes in the pandemic, such as curtailing or suspending some programs and activities. We have regularly encouraged our academic units and our faculty across the university to have their own contingency plans in place should adjustments be necessary, but we remain optimistic that these alternate plans will not be necessary. Also, for example, if the course of the virus changes, large gatherings and events could be impacted, which underscores the importance of people getting vaccinated, as President Barron has indicated, and following all the mitigation measures. However, we don't believe that a move to remote education will be necessary, as there are plans that we know have proven to be successful in keeping our students in the classroom. But it is up to all of you, and if everyone follows our guidance and policies. Most importantly, our plans include doing everything we can to keep our students on track to complete their education and earn their degrees. And we are focused on providing as many opportunities as possible to engage with their peers in person, on campus, this fall. We are confident that we have the right processes in place and can flex and adjust as needed if and when circumstances change, but we remain humble in the face of this virus.
Thank you, sir. Kelly, since the start of the pandemic, the CDC and the Pennsylvania Department of Health have released guidance that has been used to inform Penn State's COVID-19 mitigation strategies. How will you take these into consideration moving forward?
The CDC and the Pennsylvania Department of Health guidance is and continues to be very important sources of information for us and informs our decisions in our data analysis going forward. And as it has throughout the entire pandemic. The university leadership and myself, we are looking at the data routinely. We are looking at all the updates, and we're in regular contact with the Department of Health here in Pennsylvania. They've been strong partners with us throughout the entire pandemic. And as noted by several of us on the town hall already today, we will use the guidance to continue to help inform our plans. We're also looking at local, national, regional, any indicators of a spread of the virus here in Pennsylvania. That data is readily available, and we continue to assess. At University Park, for example, one thing is our local hospital capacity. We've always said that that is very important to us, and we track that as well. I receive daily updates from our local hospital about their COVID care and what is happening with them. Again, strong partners in this process, because it's important for us to look not just what's happening within our campuses, but within our surrounding communities. So all these data inform our decisions and our process development, and will continue to do so as we move forward.
Thank you again. Damon, Lorraine, we have a complex question for you. Can you share the goals of the anonymous COVID-19 vaccination survey for students and employees? And are there findings that can be shared at this time? Lorraine, we'll begin with you on the employee side.
Yes, good afternoon, Ben. Happy to share some information about the goal of the survey, but also the results on the employee side. So the survey's goal was to understand our community's vaccine status and allow us to adjust our plans as needed. The employee survey was sent to over 35,000 faculty and staff across the Commonwealth, and we heard from more than half of our employees. The survey garnered a 56% overall response rate. So we're encouraged by the numbers. 92% of those responding indicated they had been vaccinated. And we hope that all of our faculty and staff will continue to take this virus seriously. And if they have not been vaccinated, will do so soon.
And Damon, on the student side? Damon Sims, if you could.
Similar to what Lorraine just said, this is a community health issue, of course, so we were interested in what students had to say about their vaccination status. Unlike faculty and staff and their survey, though, the student survey remains open. I think we understand the students are busy with many other things in the summer and they're traveling. So we want them to take the opportunity still to complete the survey, which is open until this Friday. And I certainly encourage them all to do so. I think you've heard the word data from us, and we need as much data and insight as we can gain, so students can be very helpful if they complete the survey. But we have some early insights already. We sent the survey to 87,000 students, more than 87,000 students. 42% of those students have responded, actually 54% at University Park. And of those, 77% have said that they're fully vaccinated. So we're heartened by that bit of information. We're mindful of the fact that this survey may have a response bias built into it, but we still think that this is a valuable data point. And as I say, any students who have not yet completed the survey, please do take the time to do so. Between now and Friday, we could use the additional insight.
Thank you both. Provost Jones, could you share a bit more about the survey itself and how this compares to the rest of the state when we're looking at the vaccination rates?
Yes, certainly, Ben. We realize the limitations of a survey instrument like this, but we are very gratified with the response rates that we've seen so far, particularly as Damon points out, given that students are dispersed and busy over the summer. We're looking at the numbers very critically. We know that there may be, as Damon indicated, some response bias in the survey, suspecting, for example, that individuals who are vaccinated may be more likely, who are vaccinated may be more likely to complete the survey than those who are not. So we're trying to place all of these numbers in an appropriate context. Currently, it's our understanding that vaccination rates in Centre County, where University Park obviously is located, are around 49%, and the Commonwealth of Pennsylvania is at about 53%. We believe, based on the data that we have seen, both from the survey and from the uploads that are coming in as part of the incentive program, that our Penn State population is above the average vaccination rate at most, if not all, locations across the state. It's difficult to give precise numbers. We can only give bounds, as you've heard, but we hope as students continue to upload their data, survey data through the rest of the week, and both employees and students upload their vaccination information, we'll be able to pin that range down a little bit more precisely.
Thank you, sir. Dr. Barron, some public universities, including a number of Big Ten universities, have moved ahead with the vaccine mandate. Can you share more about Penn State's decision?
Well, obviously, each state and each university faces different circumstances, and that makes them unique in what they decide to do. What has PSU decided to do? Well, first, make it easy to get vaccinated, and second, to incentivize getting vaccinated. And now, new rules, unvaccinated must mask in our buildings. For our residence halls on arrival, you'll be tested on your arrival, and there will be testing for those that have not uploaded vaccination information on a weekly basis. There will be surveillance testing as well. And most important, there will be significant consequences for those who are unvaccinated who do not follow the testing requirements that we put out. We have a survey, other sources of data. We will let, as usual, data be the guide. But I really want to make the point, this university is not impartial to vaccination. We have numerous experts on this campus. We have data on millions of individuals who have been vaccinated. Vaccination is the best defense against COVID, and the safety of others depend on our community getting vaccinated. I ask you, please think about everybody in our community and take the step to get vaccinated and upload that information so that we know. And finally, we will continue to monitor our community, the data, and what happens with COVID. And if necessary, if warranted, we will take further steps.
Thank you, sir. Lorraine, as we prepare to return to on-campus activities, some employees have expressed concerns about interacting with unvaccinated individuals. What steps is the university taking to keep employees safe this fall?
Yes, Ben, we are always concerned about the well-being of all employees and their loved ones. And we appreciate all of the hard work over the last year and a half and are thrilled to be bringing our community back together again. So employers should prepare to return to on-site work this month as planned. As noted previously, campuses that are encounters with high or substantial transmission per CDC guidance, masking will be required, all individuals regardless of vaccination status, but that does not change our return to the workplace plans. We will continue with our in-person plans because we are confident in the health and safety measures that we've put in place. During the summer, the university announced work adjustments for faculty and staff with health-related concerns, and we've addressed those as they've come forward. I encourage all employees who have serious concerns to take them to their supervisor, department head, or their HR representative. We have a masking requirement indoors that aligns with CDC guidance, and we encourage everyone, regardless of their vaccination status, to mask up inside campus buildings. Also, for individual offices, if you prefer, you may post a sign that indicates, regardless of vaccination status, you prefer entering to be masked. And we hope everyone in our community will respect those requests, but meetings can be rescheduled to be remote if necessary. In addition, office areas have been provided cleaning products and hand sanitizing stations. We must all do our part to continue to be diligent about hand hygiene. If we feel unwell or sick for any reason, don't come to the office, and please call your healthcare provider. Now, finally, I should note that these are stressful times, and there are mental health resources available to faculty and staff through the Employee Assistance Program. So if anyone is in need of that assistance, more information is available for that kind of support on the HR website.
Thank you. Damon, Dr. Barron shared that the university will be testing unvaccinated students living in residence halls. Can you talk a little bit about the strategy behind that testing?
Sure, Ben. I think if the folks joining us today hear a particular drumbeat, I hope it is the beat of vaccine, vaccine, vaccine. The science is abundantly clear. Vaccinations work, and we want everyone who can get a vaccine to get a vaccine. But the vaccines end up being only one tool. We understand that some of our students will not be vaccinated. Our residence halls are dense communal living spaces. So we're going to use testing as another tool to do what we can to mitigate against the virus. Those who are unvaccinated, as has already been said, are going to face testing, of course, when they arrive, but then they're going to be tested weekly to ensure that we can detect the virus where it occurs. We can prevent spread. We can identify clusters before they become hugely problematic to us. This will help us manage our quarantine and isolation space, the distribution of that. But perhaps most importantly, back to the question of vaccine, this is also a tool to encourage those who are not vaccinated and can be vaccinated to get a vaccine. They will avoid the weekly mandate with significant consequences if they don't honor it of being tested weekly in the residence halls.
Thank you. As Damon said, vaccine has been a common refrain today. Kelly, if a student wants a vaccine, where can they get one? Is the university planning on offering COVID vaccination clinics for students and employees?
Yes, vaccines are widely available to anyone across the state of Pennsylvania and frankly across the United States. You can visit an online website. It's called vaccines.gov, that's G-O-V, to find a vaccine provider that is close to where you live right now and to begin vaccine if you have not already completed your vaccination. And throughout the fall semester, we will have vaccine either available on a campus or around the campus at local vaccine providers to direct for students to use. At University Park, for instance, our University Health Services is preparing and will offer appointments for vaccine starting beginning on September 2nd on Thursdays and Fridays. You can make an appointment when you get here to University Park to set up and get your vaccine at University Health Services. They're also going to be holding an actual vaccine clinic on August 23rd and 24th, where students can come and get their first or second dose of vaccine. They're using Moderna vaccine. We're using that here at University Park. That said, if you can start your vaccine where you are, please go ahead and do that. Then take your vaccine card and bring it with you when you come to your campus, and you can get the second dose here at the campus or in the local community around your campus. So it's perfectly okay for you to start somewhere else and then travel and get the second dose at your arrival place. And remember, it takes a minimum of 2 weeks after your final dose of vaccine for you to be considered what we call fully vaccinated. That's if you have a 2-dose vaccine 2 weeks after your second dose. If you have a 1-dose vaccine, then it's 2 weeks after that single dose. So important to be thinking about that timeline. We know many of you have already vaccinated, and we are hoping that you will upload that information, and we're happy when you do that here by August 9th. But there are those of you out there that haven't yet started. And so no time like the present to begin that process, but you can finish it up when you get to campus.
Thank you. Provost Jones, will students who have to go into quarantine or isolation this semester be able to join their classes remotely?
Our plans for the semester are to offer a fully in-person experience, including, of course, all of our classes. So there will not be remote options for most classes planned. As with previous years, students will work with their instructors if they have to miss class due to illness, or in this case, due to quarantine or isolation. I will beat the drum as well. This is yet another reason to get vaccinated. There may be some breakthrough cases in vaccinated individuals, but the majority of those who have to go into isolation and quarantine will be students who choose to forego getting vaccinated. Students who are unable to get vaccinated for any reason have the option to switch to World Campus for the semester to avoid having to miss classes in case they were to be impacted by quarantine and isolation. In all cases, we of course are asking our faculty to be flexible and work with their students as they always do, who have to miss class for quarantine or isolation purposes.
Thank you. Damon, we've spent a lot of time discussing COVID-19 and available resources. Can you talk a little bit about general support for students during the upcoming school year?
Sure, Ben. I think this is a university that is always renowned for many wonderful things. Among them actually are its size and scope. But I like to tell people that the thing we ought to be most known for is how we make a large place very small. We are very attentive to the individual needs of every student. Whenever we find a need, we work really hard collectively to address that need, whatever it might be. And that is true through COVID as it has been for decades before. So I can assure you and others that we continue with that ethic, that commitment. It's a community of support across the university. Colleagues in every unit are committed to our students in that way. We have offices that are as aptly named as student care and advocacy. What better office to tell you what we are committed to than that one, I think, which can help a student with any number of issues that they may face and tap them into the other resources available at the university to make sure they get the help that they need. This is a time of great stress, of course, unusual stress for our students. We are mindful of that always. Counseling and psychological services has been beefed up in recent years, and certainly in the last year and a half of COVID, we have found new ways to deliver those important services and programs, and we will continue to do exactly that as we recognize the stresses that this continues to present for our students. We are concerned about the financial well-being of our students, and we understand that some, because of circumstances related to COVID or otherwise, are faced with some significant emergency needs. And so we have a student emergency fund available to them. We have given renewed attention to housing and food security issues, and we have a pantry, Lions Pantry, for students who are in need of food, and we are doing other things on that front. I could go on for the rest of this program talking about the services that we offer to students to support them, but I just want to assure everyone that whatever a student's need is, we are equipped to address it. They just need to let us know that they have a need, and we will do all we can to help them overcome it.
Thank you, sir. Kelly, will testing be available in the fall for students and employees who may have been exposed to COVID-19?
Yeah, great question. Thank you. So contact tracing has evolved over the last several weeks as the new Delta variant has presented new information. And so the answer is yes. When somebody, a student, I'll start with students, when students are identified as a close contact to someone who has had COVID-19 or is currently infected, we will refer them to testing on our campus and across the Commonwealth at our Commonwealth campuses. We have various means to do that testing. And this semester, we're also partnering with our Vault Health partners for our testing capability. So we'll have that ability, and students will get called. It will happen. We'll also have what we call drop-in testing, and that's that walk-up testing that students have grown accustomed to on our campuses as well. It's varied a bit across the Commonwealth at the various campuses, but up here at University Park, we will have large testing areas where students can come in if they feel that they've been exposed as well. They don't need us to call them to tell that. They might have already known or be told that they've been exposed to COVID. And here's a really important point too, that folks are going to have symptoms. They're going to have symptoms of COVID. Even if you are vaccinated, it's still important to get a symptomatic test and to seek out healthcare as a student to confirm that you either have COVID or you don't have COVID, even if you're vaccinated. So really important message. For our employees as well, they could be contacted through contact tracing mechanisms and need to go and get a test if they're a close contact. And even if it's changing whether you're vaccinated or not, what the contact tracing requirements are. And so we'll talk to each individual when this happens through tracing. I'm very confident that we'll have that ability and capability. It's very robust, and that will help us as we move through the semester. And then our employees as well have access to the health plan or their personal health plan. And we also will have a Vault Health order at home capability so that someone could order a test, an employee, to come to their home and they could take that test in the comfort of their home. So we do have these layers. We've talked about layers over the past year, and we'll continue to have some layers for both our students and our employees.
Thank you. Provost Jones spoke a little bit about quarantine and isolation earlier. Damon Sims, what is Penn State's approach for quarantine and isolation this fall? More broadly, will it be similar to past year? And what about the Commonwealth campuses?
Well, Ben, one of the silver linings in the past year, and we're all eager to find silver linings, is that we've learned a lot from that experience. I think we've learned how to do some of the things that continue to be needed well. And I think quarantine and isolation space, the provision of it, the services necessary to support it, is one of those things that we have learned to do well. So we are poised as we begin moving toward the fall semester to offer quarantine and isolation space again. The space has been identified at all locations. In some locations, it's on campus, of course, at University Park, for instance. At other locations, it will be off campus, but near campus. We've identified locations to provide this need. It's important, I think, for people to understand. Sometimes they get confused about the terms. Isolation is, of course, when someone tests positive, they go into isolation, and quarantine is for those who've been identified as close contacts through the process that Kelly was just referencing. So our residence hall students, we will have quarantine and isolation space certainly for all of those. Students who live off campus who have these needs will be coached through the best way for them to move forward to provide for quarantine or isolation. We will give them all the support that they need. Certainly our contact tracing team is fully up to speed on the latest guidance. And so I think they're going to be well positioned to provide that kind of support. One thing that is different this year, because we have vaccines in abundance, and we hope, again, that everyone's taking advantage of them. If you are fully vaccinated, but you've been exposed to a known or suspected case, then you're to be tested, I believe, 2 to 5 days after the exposure. You should wear a mask indoors for 14 days or until you receive a negative test. So that's a change in the CDC's guidance in recognition of the fact that, of course, we're all going to be vaccinated. And so that puts us in that position vis-a-vis that situation.
Thank you. Kelly, can you talk through Penn State's approach to cleaning and sanitizing as we prepare for the fall?
Yes, so we believe we're taking all the right precautions across our campuses for our environmental space and our spaces in everywhere. We've learned more and more about the virus, and we've known that the evidence is there that it's generally not transmitted from surfaces or surface contacts, and so that's important, and that has changed the approach to doing cleaning protocols in spaces. The main transmission of an infected person is with close quarters, right? Close quarters. And so we know that is happening with people who are together for extended periods of time. Our professional staff at our Office of Physical Plant has done an outstanding job, I think, throughout the entire pandemic in cleaning buildings for their regular cleaning cycle. And they have practices, should we need to do an extra layer of cleaning in a particular area, they are on it and they know exactly what protocols to use to take care of that. For our heating and air conditioning, we've had questions about that. We have met or exceeded all the Pennsylvania Department of Health, the CDC, and the American Society for Heating, Refrigeration, and Air Conditioning Engineers guidance every step of the way. Really important to share that information every step of the way. And we've adjusted the operations based on the science and when the science has supported those changes. So I think, again, I'm going to reiterate what we said before. It is still a very good idea to do frequent hand washing. Those personal hygiene efforts that you can do now will continue to remain important through the fall, especially as we, not just for COVID, but as we enter back into a flu season coming this fall. Hand washing, terrific. Wear a mask. And to stay home if you're experiencing COVID-19 symptoms. Lorraine said it a little earlier for our employees, and I echo that for our students. It's important that you seek proper health care if you are experiencing symptoms so that we can help you understand whether or not it's a COVID-related illness or something else that's affecting your health.
Thank you. Damon, is there anything additional you'd like to share regarding guidance for students?
Well, I want students to know that we are, as President Barron said at the outset, excited for your return. We really are, and we have been working hard to think of everything that we need to do to ensure that you have a robust experience in person, both in the classroom and, very importantly, outside the classroom. We know how important the whole experience that students have at Penn State is to each student, and we are committed to doing all we can to make that happen the way it should. But in exchange, we ask you to do all you can to make that happen as it should. There is guidance, abundant guidance that we are providing you today. We're encouraging you, of course, to vaccinate if you have not, or upload your data to us if you have been vaccinated and haven't done that yet. Student organizations are always important at Penn State. I heard from a lot of students this summer about disappointment from last year and the inability because of COVID to engage in the outside the classroom experience in the way they would have liked. We need for our student organizations to return to that sort of activity, but to return to it mindful of the continuing risk that we keep talking about. And so everyone has to follow the guidance. We have to mask up where we are told to mask up and be conscious of the fact that that can change as circumstances on the ground change. But we're doing all these things with an eye toward how can we ensure that this experience for our students is both healthy and safe and as complete as it possibly can be. We want people to be fully engaged, to have the student experience that Penn State is so noted for. And if we are able to have students work in partnership with us, as they did so often last year, I am incredibly confident that we are going to have a good year and work through the challenges that we're talking about now, because we've all learned a lot of lessons that we can apply in the year ahead.
Thank you. Lorraine, these can be difficult conversations, but can employees ask their peers if they're vaccinated? And similarly, can your supervisor ask you if you're vaccinated?
And another great question, thank you. Employees should not ask their peers if they are vaccinated. Of course, anyone is free to voluntarily share vaccination status with others, but employees should refrain from asking peers whether or not they have been vaccinated. However, supervisors are permitted to ask direct reports about their vaccination status strictly for adherence to the university's masking policy. Supervisors should not disclose this information to others and should not ask questions specific to reasons for receiving or not receiving the vaccine. In addition, supervisors should not take proof of vaccination. Rather, employees are encouraged to confirm their vaccination status via the Salesforce Health Cloud. And if you have questions or concerns about being asked about your vaccination status, I again encourage you to contact your HR representative who can assist you.
Thank you. Provost Jones, will there be specific COVID-19 guidelines or procedures for indoor events such as athletics or concerts?
Yeah, good question, Ben. Thank you. We've talked already about how excited we are to be welcoming our students back. And of course, we're excited to be welcoming campus visitors back for various events across our campuses as well. Just as we do with our employees and students, we strongly encourage all of our visitors to, guess what, get vaccinated to protect themselves and others while attending university events. Event attendees will need to follow all university guidance, including masking indoors based on the status of transmission in the county where the event is being held. Event attendees are advised to visit the Virus Info website close to their event date for the latest information on university policies and mitigation measures so that they can be prepared for their visit. Athletic events will be held in a manner that is consistent with the latest guidelines from the Commonwealth and from CDC and others. And as always, we are ready to pivot and make adjustments as necessary to facilitate these events.
Thank you, sir. That concludes our question and answer portion of this town hall, but we will continue to post more information and more updates on Penn State News and on Virus Info website at virusinfo.psu.edu. Dr. Barron, is there anything you would like to say in closing?
Yes, thank you. I know we're all looking forward to coming back together as a community in a few short weeks and to return to something that is closer to normal. But as I said earlier, we're still very much in the midst of a pandemic. We're continuing to monitor the course of COVID-19, and we will make adjustments to our plans as needed. As you've heard, the university has developed a series of on-ramps and off-ramps as part of our plans to mitigate COVID-19. We're hopeful that we will not have to make further adjustments, but we need our entire Penn State community's help. For us to have a successful on-campus experience this fall, it's going to take all of us, students, faculty, and staff, doing our parts. The success of this semester is largely up to you and your willingness to get vaccinated. We have so much to look forward to in the fall. In the meantime, I want to urge everyone to maintain their vigilance If you are not yet vaccinated, please, please do so as soon as possible. If you feel sick, please get tested so as to prevent the spread of COVID-19. Together, we can make this semester a great success.
I want to thank President Eric Barron, Nick Jones, Damon Sims, Lorraine Goff, and Kelly Walgast for joining our discussion today. Please keep an eye out for a short follow-up news brief, which will include the archive video from today's session for those who may have missed it, and a link to a survey so you can share your feedback and tell us if there's something you would like to see at the next town hall. Please also bookmark and continue to visit virusinfo.psu.edu. That's virusinfo.psu.edu. For the latest updates and information, you'll find a link on this site, liveevents.psu.edu. Thank you all and good evening.